Thank you everyone for joining us today. So this is the Closing the Gap Network webinar talking about our new Closing the Gap Collaboration Funds. So the webinar today is just going to go through a bit of the guidance and followed by a question and answer session. So, sorry, I'm just trying to move my slides on. Okay, so I'll just introduce you to the webinar team today. So there's me, Emily Peckham, I'm the network manager. We've got Paul Heron with us. I don't know whether you can see us all or not, but I'll just wave and then Paul can wave in case you can see him. So he provides the data management and visual dissemination support to the Closing the Gap and to our associated health and wellbeing cohort. And then we have Dr. Panos Spanakis, who's a research associate with us. He's joined the team quite recently. Panos, can you wave to the... So this is Panos, and finally we have Liano Pavlidou, who has set up the webinar for us, and she's our administrator, and she's very recently joined the team as well. So welcome everybody, and thanks for joining us. So please note our session is being recorded, so the recording may be made available public and according to GDPR guidelines. So just to let you know that, so that anyone who is unable to attend today can watch the webinar afterwards. So just a little bit of webinar housekeeping before we begin. So all attendees have joined in the listen and view only mode. So your microphone and camera are switched off at the moment. If you've got any questions during the webinar, please do feel free to ask questions as we go along. And if you have a question, please click the Q&A icon in your Zoom control panel. So that's that icon there in the Zoom control panel. If you can't see your Zoom control panel, sometimes it appears at the top of the screen if you just sort of hover over the top of the screen, or if you hover over with your mouse at the bottom of the screen, you'll be able to make the control panel appear if it's not there. And then if you've got a question, just put it into the questions and answer box and submit it. Your question will be anonymized. You'll be able to see any questions submitted by any other attendee and read or hear the given answers. You'll be able to make comments too. So please do use the Q&A icon to ask questions as we proceed. So we also have the chat option. So that's this other one here, the chat, which is sort of like a little speech bubble in your Zoom controls. And that's going to be used as a platform to share relevant links and documents with you. So as we go along, if we think there's a document or something you'd like to link to, we will use the chat function to disseminate that information. So just so that we've got a distinction between what we're doing in the question and answer and what we're doing in the chat. If you want to notify us privately, if you have any issues, then please do so using the chat function, because then you can send that to a specific member of the webinar team. We're going to go, as long as we go along, we're going to do some polls, and these will be anonymous. You'll see the poll results on your screen right after the end of each poll. So that'll become more apparent as we go along, and you'll see what happens with the polls. And that's just where we're going to ask people some questions and then see what the responses are. If you're interested to meet new teammates, people that you'd like to collaborate with, you'll be able to introduce yourselves to the attendees at the end of the session. So when we get to the question and answer part of the webinar. If you would like to do that, then click the raise your hand icon in your Zoom controls, and you might need to just click on the more option to raise your hand so you can see additional Zoom controls. So at the end of the webinar, when we get to the questions and answer, if you want to introduce yourself to the other people attending the webinar, in case you want to meet other people that you potentially would like to collaborate with, then raise your hands and we'll promote you to a panelist, and your AV will be on, so you can then introduce yourself and show everybody what you look like if you wish to do so. So that's just a little bit of webinar housekeeping, and on to the next, what we're going to talk about in the webinar today. So in part one of the webinar, we're just going to give a quick overview of what the Closing the Gap Network is, why we're here, what the gap is, what causes the mortality and health gaps, and the focus of the network. In part two, we'll talk a bit about the Collaboration Fund and go through the core guidance. And in part three, we'll just explain our research framework, what our aims, goals and questions are, so that if you're intending to apply for the Collaboration Fund, you can ensure that you align what you're doing with our research framework and goals. So make a start now. So the first poll that we wanted to ask you about was, what is your current role? So we're going to launch the poll in a moment, and that will give a few options as to what your current role might be. Please select the option that you feel most fits what you are. Okay, have we got everybody's responses? Yeah.
We've got 11 responses out of 13. So 64% of the attendees have answered researcher, 27% health or social care professional, and 9% service users or lived experience.
Thank you, Fiona. So that's a nice introduction to who we've got on the webinar today, to give everybody a bit of a flavour of who's here.
Mm-hmm.
Okay.
I have just shared the result as well with the audience.
Okay.
There we go.
Okay, so the audience can see the results. So shall we move on now to the next slide? Okay, so this just shows the founding partners of our network, just to give you a bit of an idea of who's behind the network. I won't go through them all, but just so you can see the pictures. And we are one of 8 mental health networks. We're the only network in the north of England, and there's one network located in Scotland. The rest of the networks are located in the south and southeast of England. So that just shows you who we are and what we're part of. So there are 8 of us. And so we'll talk now about closing the gap. So what's the gap and how did we get here? So people with severe mental ill health experience some of the most profound health and mortality gaps of any section of the population. You can see from this slide here that so you can see the red line going up and the blue line going up. That's the general population, and you can see that year on year the life expectancy is increasing. But you can see for the people with severe mental ill health, those are the lines that are on a more of a downward trajectory, that the life expectancy, in contrast to those in the general population, is slightly decreasing, and the gap between the general population and people with severe mental ill health is increasing. So that's what we at Closing the Gap are trying to do. We're trying to narrow this health gap. So here I've got a slide showing the mortality gap in terms of life expectancy in South Yorkshire and Bassetlaw. So I live in Sheffield. So this slide that I've got here, the data I've got here, is the data for South Yorkshire. And you can see there that people, males without a mental health problem, have an average life expectancy of 81.2 years compared to people with a mental health problem of 62.6 years. And you can see in the red bar, similar story for females in South Yorkshire as well. So that just brings it into a bit more, it's a bit more real when you see, you know, an area and what the mortality gap that people might be experiencing. So just move on to the next slide, which talks a bit about physical health conditions. So people with severe mental ill health are more likely to have physical health conditions than those in the general population as well. And you can see from this slide the different sort of the increases in likelihood of somebody having a particular health concern. So you can see that people are more likely to have diabetes, are more likely to have COPD, 2.1%, are more likely to have coronary heart disease. So that slide just gives you a quick overview of some of the physical health conditions. So the causes of the gap are complex and multiple. So what drives it? There's chronic, preventable and modifiable physical health problems, such as those we've just discussed, behaviours that pose as a risk to health, such as smoking and poor diet, and wider social factors such as employment and the areas that people live in, poverty and living in deprived circumstances, and the possibility then of living in a more obesogenic environment where it's difficult to access healthy food. and failures in health services to address people's needs, the effects of medication, particularly in terms of weight gain, where some types of medication will lead to increased weight gain. And then there's, of course, stigma, discrimination, isolation and exclusion. So there are many reasons that drive the health and mortality gap of people with SMI. So the focus and aims of our network are to understand and reduce the physical health and mortality gap that people with severe mental health experience. And to do that, our aims are to understand the causes and consequences of the health and mortality gap, and to identify the most effective ways to mitigate against those causes and consequences. So that's our two main aims of the network. So in doing so, we want to kickstart research and innovation in this area, taking an interdisciplinary approach, bringing together people from all different disciplines, such as those listed on this slide. We want to build capacity to undertake research and mobilise knowledge around best practice. So once we've done the research, we want to ensure that the results of the research get out to those who need to know it, and not just publish things in a research journal where a few people would read it, but try and make things more publicly and widely available so that research gets to those who need to know about it. We want to nurture a national and international network, and we want, most importantly, we want to leave a legacy, and we want to help reduce the mortality and health gap that people with severe mental ill health currently experience. So now on to the funding round and the explanation about the funding and what we're trying to do with this funding and how to apply. So what we want to do with this collaboration call is provide short-term support to facilitate the formation of new collaborations and partnerships in the area of severe mental illness. So we want to stimulate research into the inequalities that people experience and to build cross-disciplinary research capacity. And that is to understand the causes and consequences of the health and mortality gap and identify the most effective means to mitigate against these causes and consequences. So the aim of the Collaboration Fund is to provide short-term support to generate new collaborations to enable us to meet those aims. So some key information about the Collaboration Fund. Projects should consist of well-defined activities and must involve the formation of a new collaboration. So if it's an existing collaboration, then it wouldn't be eligible for funding. So you need to demonstrate in your application that you'll be forming a new collaboration, bringing together people who haven't previously together worked before. We'll fund up to projects up to £2,000 at 80% full economic costs. So for example, if you applied for £2,000, we would be able to fund 80% of those costs. And that's in line with UKRI guidance. UKRI is the funder that funds this mental health network. This is an open call. However, projects will need to have completed their project within 12 months of receipt of funds. So the call isn't going to close this year. We will review it later on in the year and see how it's been going. But at the moment, it's an open call, but you will just need to ensure that your project's completed within 12 months of receiving the funds that you apply for. In accordance with UKRI guidelines, applications must be led or co-led by a UK higher education institute, and that's due to our funders' guidelines. Non-academic bodies, charities, third sector organisations and other relevant bodies are welcome to apply, but they need to be co-led by a university higher education institution. And what we really want to do is encourage people to form collaborations with non-academic bodies, charities, third sector organisations and other relevant bodies. So it would be really good if we saw that people were joining together with other people, not just within universities, but from other organisations as well. And that's really what we're looking for within this collaboration fund. So if you are from third sector or other organisation, the next poll is, have you identified a higher education partner? And the purpose of this poll is for us to know whether people are looking for partners are looking to find partners, and then we can try and help people to find them. So I'll just over to Piano to generate the poll.
There we go.
So have you identified a higher institution partner?
So we've got 9 answers out of 13. 78% have answered yes, and 22% have answered no.
Okay, thank you. So we've shared the results with all of you so you can see. So for those of you who've answered no and are looking for a higher, if you're looking for a higher education institution partner, you're welcome to introduce yourself at the end of the webinar by using the hands up, the put your hand up function, or if you want to email us privately at ctg-network@york-ac.uk, we can then support you in trying to identify one. So if you do need help to identify a partner, please do let us know and we will help you to do that. Thank you, everybody. So we'll move on to the next slide now. So in terms of eligibility, am I eligible to apply? We're strongly encouraging applications from early career researchers. If the main applicant is on a fixed term contract with a contract end date before the end of the project or very shortly afterwards, we'd like you to ensure that a further project supervisor who could take over or oversee the completion of the project would be named. But we are strongly encouraging applications from early career researchers. So just in terms of whether we've got any early career researchers with us today, please could you answer the next poll? Are you an early career researcher? I'll pass you back over to Diana.
Hello again. So, are you an early career researcher? So, 11 out of 14 people have answered this poll. 45% have answered yes, and 55% have answered no.
Thank you. So really encouraged to see that we've got quite a few early career researchers in the webinar today. Really are strongly encouraging and really wanting to early career researchers to join our network and to support with us. We have got an early career a network specifically for early career researchers. And again, if you've not already joined that network and you'd like to do so, please email us at ctg-network@york.ac.uk. And I can see there's been a question there about early career researchers, I think, about the definition of early career researchers, and we leave it open for people to define it for themselves. So if you identify as one, then, you know, this was for the poll, I guess, say yes. But in terms of how we're defining it, we're leaving it for people to self-identify as an early career researcher, because we know particularly in health and social care, people may not follow the traditional research career trajectory of some of the other sciences. So thank you for that. So in terms of how we decide who gets funded, applications are going to be reviewed by 3 members of the core network team, and we're going to be using the following criteria to review those. So relevance to the closing the gap aims and objectives. So it's important if people are making an application that they signpost to how their application is relevant to our aims and objectives. The likelihood of leading to a viable research proposal. So what we're aiming to do with the Collaboration Fund is enable people to form new collaborations and then apply to other funding pots, such as the funding call that we'll be releasing later this year in the summer for our Closing the Gap Network Plus fundings, very much as we really had the call last summer, or indeed to another funding application stream, such as another UKRI or NIHR. So we're really looking for people to form a collaboration that they would like to then apply to another funding stream for, either our Closing the Gap funding or to another funding stream. So one of the other things that we will be looking for is evidence that the project is forming a new rather than an existing collaboration. And that's a really key thing. So you do need to make sure that you've convinced the people who will be reviewing the application that this is a new rather than an existing collaboration. We also want to ensure that we're creating opportunities for early career researchers. So we'd really like to see that early career researchers represented within the collaboration that you're forming. And finally, we'll be looking at the appropriateness of the funds requested to ensure that people are requesting an appropriate level of funding for the activities that they wish to undertake. So on to the next slide. So what must my application cover? It needs to have a clear description of the project's aims and objectives, a description of the new collaboration that will be formed, who will be in the collaboration, or if you've not got a specific person to name, an organisation that you're intending to bring into the collaboration. Evidence that the project is in an area of demonstrable funding opportunities, so that the project is likely to be able to apply for funds once you've developed the collaboration. And a project plan and commentary on the significance of the information and how the success of the project will be measured. So what you'll do to measure whether or not your collaboration and the aims of your collaboration have been successful or not. So how much should I really bid for? We'll fund projects up to £2,000, but the application should be aligned to appropriate funding required to carry out that activity. And it's £2,000 at 80% full economic cost, in line with UKRI guidance. So what costs will the grant cover? Please show 100% of the full economic costs of the proposed research, and we'll fund 80% of those in line with UKRI guidance. And we've got a link there at the bottom that tells you a bit more about FEC and UKRI guidance. So I'll just leave it a moment so if people want to note that down. So in terms of allowable costs, funding may be sought to cover the direct incurred in developing the collaboration, including things such as venue hire and catering, travel to attend collaboration meetings, public involvement costs. So that could be in terms of public involvement travel, or in terms of reimbursing members of the public for their time, such as giving them a voucher. So we can also support directly incurred costs of an administrator or technical support and consumables, but these should be appropriate to support the collaboration activities. So things not eligible for funding. Awards will not be made retrospectively. So this means that the work for which support is requested must not have commenced before the award is announced. So the work must not have started before the award is announced. We will not fund computer hardware, including laptops, electronic notebooks, digital cameras, etc., the cost of academic staff time, books and other permanent resources. So in terms of how we'll assess value for money, are the funds requested acceptable in relation to the planned work and the outcomes likely to be achieved? Does the proposal demonstrate value for money in terms of the resources requested? And will the proposed project lead to a grant application? So how do I submit my application? So application forms should be submitted to the Closing the Gap Network at ctg-network@york.ac.uk. An email should carry the subject line, CtG Collaboration Proposal, and then the applicant's surname. So this is an open call. It's going to run to the 30th of September 2020, after which we'll review it and assess how much funds we've got left. And if we have sufficient funds, then we will continue to run the call. The form can be downloaded from the website, from our the Closing the Gap website. On our funding pages, we've got the form in terms of the form that you need to complete to make the application, and also the guidance notes form. And I can see there's a question about sharing the slides after the end of the webinar, and we will be sharing the slides after the end of the webinar. So you'll be able to obtain all this information from the slides as well. So just a few things to note. Please include a CV for the principal applicant and any co-applicants. The CV should be included at the end of the application form. It must not be sent as a separate file, and it should be no longer than 2 sides of A4. If you want to attach a Gantt chart, then you can, but that's optional. You don't need to do that. So we'll have our next poll. So do people already have an idea for an application that they want to make? So I'll pass you back over to Fiona.
Okay, last poll for today. Do you already have a formed idea for an application? Okay, 10 out of 12 people have voted. Really good news. 80% of the voters have answered yes and 20% no.
Okay, thank you, Fiona. So we can see there. So if you haven't got an idea for an application, but you're looking for a collaborator, please put your hand up when we get to the Q&A and you can introduce yourselves. Or if you want to speak to one of us, then send an email to our email address and we can speak to you and arrange a time to talk if you want any support with that. So the final part of our webinar today is just to give everyone a very brief overview of our research framework so that you can determine for yourselves whether your plan fits with our aims and is aligned to our aims and objectives. So let's just quickly go through this. So we've got the two aims that I already mentioned, understanding the causes and consequences of the health and mortality gap and identifying the most effective ways to mitigate against these causes and consequences. So the collaboration needs to, in some way, be aimed to address these two things. We have some themes within our network. We have health and social inequality, green and blue space, big data, knowledge mobilisation, digital technologies, and arts and creativity. To find out more about our different themes, this is all detailed on our website, but just to highlight that these are our themes. Ideally, when we're looking for things, we're hoping that people will apply to one of our themes. Although if somebody comes up with an idea that really is still working within the area that we're working in and isn't listed, then that's fine too. So there we are, that just shows you a screenshot of our website and how you can find information about our different themes. So we have the 4 themes that the green and blue space, big data, arts and creativity, and digital technologies. So those are our individual themes. And then we have the cross-cutting themes, which are health and social inequality and knowledge mobilisation. I'll just give you a moment to read the information about those themes. So in terms of our research framework, we've got the themes, and we've got our aims, and then we've got some goals. So we've got our research goals A's, and these are to understand the causes and consequences of the health and mortality gap. This is all on our website, but we can also send it to anyone if they wish to do so, if they just send us an email. So our research goals are to understand how people with SMI perceive and use green and blue space and the nature of any differences with the general population, to explore how integrating data sets on health status and use of health services with other data sets, such as environmental data, can deliver new insights into the determinants of health for people with SMI, to develop ways in which digital technologies can be used to sorry, I can't read the slide now, to reveal the connections between personal health, activity and lifestyles for people with SMI, to explore innovative, creative ways to engage people with SMI in the network that increase well-being and physical activity, and to understand the role of social and economic vulnerability in both generating worse health for people with SMI and an individual's ability to make gains from intervention. So those are our goals around understanding the causes and consequences. And we've also got some goals around identifying the most effective ways to mitigate these causes and consequences. And there are 5 research goals there. To determine the most effective roles and responsibilities of primary and secondary healthcare sectors in understanding and supporting people with SMI and supporting interventions. To determine the effectiveness of existing initiatives to promote the use of green and blue space for people with SMI. to design and pilot new initiatives, including technology-based interventions to increase physical activity of people with SMI, to determine the best way to prevent initiatives from generating further health inequalities through social and economic vulnerability and investigate promising initiatives that reduce them. And finally, to develop a new data resource, including integration of data sets for future research on inequalities affecting people with SMI. So these are our research goals. However, if somebody has a good idea that we haven't thought of, then that doesn't mean that we wouldn't fund it. So finally, our principles. So these are our core principles, and these are what we would like anybody who makes an application to adhere to. So scientific rigour, collaboration between disciplines, innovation, and co-production with people who've experienced severe mental ill health. So we'd particularly also welcome collaborative applications to the Collaboration Fund that include people with lived experience. In terms of our other net principles, we want our network to be sharing, participatory, inclusive, engaged, innovative, and outward facing. So these are what we mean by these terms. Sharing, a collective vision and endeavour. Participation, co-production and co-ownership. Participatory, involvement of people with lived experience in the research, active engagement with those involved in policy, delivery and practice. And inclusive, a sensitive and supportive approach, commitment to understanding contextual bias. Engaged, integration of local advocates and community members into the network activities, working with people with lived experience. Innovative, commitment to novel approaches and commitment to interdisciplinarity. And outward facing, effective communication and knowledge exchange before, during and after research. Engagement with the external research community and policy and delivery relevant. So now we come to the end of the presentation side of our webinar and on to the questions and answers. So if you've got a question, please put your hand up or type a question into the Q&A box. Thank you for listening. So has anybody got any questions that they'd like us to answer?
So we've got a question from David.
Yeah.
David says, you refer to people with lived experience, but does this include caregivers?
Yeah, thank you for that question, David. That's a really good question. And yes, it does. We're including caregivers as people with lived experience, and we'd really welcome caregivers to be included within the applications. In some groups of people with lived experience have been particularly difficult to, been hard to reach. And we really do want to ensure that we hear the voices of as many people as we can. So including caregivers can be a vital means of including some people who are particularly difficult to reach.
So we've got another question from Joe. So Joe's asked, can some of the organisations in the new collaborative have worked together previously, but with additional partners?
Yes, that's fine. And we'd really encourage that. So if people have worked together, that's fine, as long as you're bringing in new partners so that there's some element of a new collaboration being formed. So you can have worked with some of the people in the past. It's just that we want to ensure that there are some new partners and it is a new and developing collaboration.
Great. So we've got another one from Ruth. So Ruth says, thanks. If the project doesn't happen until much later in the year, then can it feed into future Network Plus calls rather than the one in the summer?
Yeah, so what we're hoping to do is to, and we're just finalising this now, is to have a final Network Plus call later on, either later on this year or early next year, so that to give people the opportunity to feed into another call. we got any other questions?
We'll just give it a moment, see if anyone else asks anything.
Yeah. Would anybody like to introduce themselves, and we can allow people to, we can unmute them and they can speak. If anyone would want to introduce themselves, if anybody's looking for collaborators, then they're welcome to do so.
All right, yeah, we have some interest. So for those that are interested to introduce themselves, I'm going to upgrade people in panelists so other members of the webinar can see and hear them. When I'll do that, you might be logged off momentarily, but if everything goes well, you should be brought back. So when this happens, if you can give a short introduction of yourself and what you're interested in. So Angela, I'm gonna start with you now. Bear with me for a moment, and I'm gonna upgrade you. Promote, yeah, upgrade, probably not the best choice of word. Promote you to a panelist. And Angela shall be joining us again in a moment. Can you hear us, Angela?
Yeah, I can hear you.
Excellent.
Yeah, can you hear me?
Yes, yes.
Yeah, brilliant. So my name's Angela Hancock. I go along to the Parent and Carer Forum at Humber, so in Willoughby. I don't know if there's anybody who's connecting from that group. Obviously, at the moment, we're not meeting. I've also been to some of the commissioner meetings. So some of the commissioners in the local area, in the East Riding area, have been putting on mental health chat meetings, which have been really useful. That's the first time they've ever done it, to my knowledge. I also went along to the Rethink Carers group, but it's a very small self-run group. And they were struggling with kind of who to bring in as speakers, linking in, etc. And they didn't seem to have the kind of information that I was looking for. So I've at times felt quite isolated as a carer and felt in quite a difficult position and not always knowing how to access material, information, link things up, get support, etc. So that's why I was really pleased that when I was at the Carers Forum, the Patient and Carers Forum, I don't know exactly who I met, but I met someone who linked me up with yourselves, and so I get the emails. But I'm a bit dipping in and out because I work full time, and at the moment I'm kind of, I don't know about other people, but it seems like we're more busy. So I work at a university and students are contacting me because they've got assignments to hand in, and it's all digital and stuff. So I am going to have to go out at 3 because I'm doing more tutorials, but I just wanted to join you and say hi, and I'm really glad you're doing this. My background also is in youth work, and I set up a group for a group of young people with a first episode of psychosis with the early intervention workers. So it was a collaboration between youth workers, early intervention service and young people, and it's a group that still meets. Even though I left, I took voluntary redundancy and I've gone into another job, but the group still meets. So that was very privileged to be involved in such a piece of work, really.
Thank you, Angela. It's
Thank you.
great that you for introducing yourself.
Thank you.
And if you if you want to ever come along to our events, then you'd be very welcome to do so.
Thank you.
Once we get our face-to-face events back online
Brilliant.
again, hopefully at some point.
Brilliant.
So Mia is going to wanted to introduce herself.
I'm gonna make Mia.
We can see Angela now as well.
Oh, great. Hi, Angela. I'm gonna bring in Mia now, and David is next.
Okay. Have we got any more questions in the Q&A?
Yeah, we've got one from David, who's asked, have you any reflections on the impacts of COVID-19 on bidding?
Okay, shall I just answer that and then we'll move on to Mia's introduction. So on the impact of COVID-19 on bidding. So I think in terms of your bids, if you just include a might not be possible in light of COVID-19. So if some of the activities are
I'm losing Emily. Is everyone else?
Yeah.
in terms
Yeah.
Wait,
Oh, sorry, have you lost me?
Yes.
Yeah, if you can repeat that, Emily.
Oh, sorry, everybody. Sorry, yes. I was just saying, if you just include a little bit about COVID-19 in your bid, so put what your aspirations are, what you'd like to do, but then might have to just put what might be, you know, the bits that may not be quite as feasible, because it will depend on what happens with the current situation to some degree. So in terms of people, if people want to arrange face-to-face meetings, then I think it'd be useful to put them in the bid, and then if you and just have a bit highlighting what would happen if you were unable to do so, how you'd do those meetings instead. And I think that's important, because what you don't want to do is find that face-to-face meetings become possible you know, within the timescale of your bid, and then you haven't costed them in, so you can't do them. That would be a shame. So that would be my advice on that. So over to Mia, if you'd like to introduce yourself.
Hi everyone. Thank you for having me. That was really interesting and very useful. I still need to make sense exactly in terms of how to approach it and how to apply. But just to say hi, and I'm the research coordinator for, I'm a lecturer at Teesside University within the Department of Psychology. My background is in health psychology, and I'm also the research coordinator of a research network called Altered Eating Research Network. If you just Google this, you'd be able to find us. And it's a multi-site sort of network, multiple institutions. We, at the moment, are working with a framework and a method that we created that are trans-diagnostic. They sort of apply across a myriad and multitude of conditions, and it's kind of centered around eating well, the pleasure and joy of food, and how that relates to mental health and physical health. And at the moment, we are in the beginning of forming a collaboration with my colleagues from Teesside, who are forensic psychologists. I don't know whether that will make us, we've never worked together. I would imagine that would make us eligible for this funding. Is that correct?
Yeah, that is. And healthy weight management is one of the areas that we're quite interested in, and we held an event last summer around healthy weight management. So it is one of the things that we've highlighted as being very important.
Fantastic. Yeah. Well, so it's really it's sort of even broader than this. It's a lot broader than weight management in itself. It's just it's about sort of eating well and sort of neurology of pleasure. The project that we're now forming is altered eating in forensic settings. So that is in settings in which people are incarcerated for one reason or another, whether they've committed a crime or not, or whether they're just a danger to themselves and other people. And that will inevitably, sounds like that will inevitably have a aspect of a kind of COVID-19 aspect, especially in light of the fact that places like that, hospitals and sort of high security hospitals and medium security hospitals have increased incidence of COVID cases, and also in light of the fact that loss of taste and sense of smell are one of the symptoms. So this is what we do. If you would like to hear more, get in touch with me. I will put my email for any kind of collaborations, etc. in the future.
Thanks very much, Mia. Thank you. Have we got somebody else who wanted to introduce themselves, Panos?
Sure, David would like to introduce himself, so I'm gonna bring him in right now.
Okay.
Hi, David.
So I'm David Shires. Can you hear me okay?
Yeah.
Yeah, hi. So my background is not dissimilar to Angela in some ways. I'm a GP by background, but involved in early intervention and psychosis development over many years. and my perspective as a carer of a daughter who's had schizophrenia diagnosed about 25 years ago. So the Closing the Gap initiative made very good sense to me as I thought about the health inequalities that we have to think about in our family. So I'm certainly interested in carer perspective. It's quite an interesting point at the moment. There's a big review done in the Lancet Psychiatry about a week ago, which talked about a position statement on mental health research. And whilst it was positive in some ways that it talked about particularly the needs of people with severe mental illness, there was not a single mention of the word caregiver. So I think I think Closing the Gap possibly might consider making it a bit more explicit that caregivers are people who've had lived experience, albeit a different lived experience to say my family member. And that's part of why I think it's very important that caregivers do get an opportunity. So one of the areas that I'm currently exploring with some colleagues is how families will experience the impact of COVID-19. I think my perspective as a GP is quite relevant to that too, because I think you know, my experience of GPs as being one and sort of working closely with them is that we're quite trusted as sources of information and hopefully relatively accessible. But again, I think this issue that carers are often not always known about by the GPs and not necessarily valued as you know, the sort of backbone of who provides support for people in the community. So I think there's some opportunity to try and make it clearer that, you know, that the potential to be gained from engaging caregivers and also thinking about how you support them better. There's clearly research opportunities. So this Lancet Psychiatry position statement not making any mention of the word caregiver, I thought was you know, was a huge omission. And as you know, Closing the Gap would be an opportunity for us to do a little bit of redress on that, I think. So I've got a variety of interests, but that seems quite topical. It's nice to say hi to Angela in particular, as a fellow caregiver. Hello. Be good to get up to something. So that's me.
Thank you, David, and thank you for highlighting, for you and to Angela for highlighting the really important role that caregivers play, and reminding us that we really need to be including them in all our work. I can't think of the right word to say there, but thank you to everybody who's introduced themselves. Is there anybody else who would like to introduce themselves?
No one has expressed an interest, but we can give people a minute just to see if anyone else would like to tell us a few things about who they are and what they do. Sorry, David?
I did notice Joe Smith's name came up, and it may not be the same Joe Smith that I worked with for 10 years or so, but it might be. So
she can let us know.
Raises here.
Let's raise the hand.
Excellent. Okay.
Can I just mention at the university I'm at, which is a small university, Bishop Grosseteste University, we've been looking at carers putting together autoethnographies, because there's a real, as David's been saying, perhaps from a different perspective, but there's a real lack of kind of having those stories in a way that are being really heard. There's a real lack of autoethnographies, particularly I've done a bit of a literature search and I found very few around schizophrenia, schizoid affective, and particularly young people's stories and carers' stories. So we, before COVID, were going to put on some training for those academics and students who wanted to do some training so that we could hear carers' stories. So we were starting to look at how, as a very small collective group of researchers, we could learn together and put something together. So just to say, I'm interested to hear what David said.
Funny enough, I'm recently come together with a lady called Elizabeth Kuipers and also Juliana Onwumere to co-edit a book which is drawing together carers' stories in terms of people with severe mental illness. So maybe we ought to just we are looking for we're looking for people who might be interested in contributing as well. So it would be good to have an email connection with you, Angela, to see if it's the sort of thing that might be of interest to you or other people in your group.
Yes, thank you.
So how will we email each other, Emily? Can you act as a conduit?
Yes, I can act as a conduit. So if anybody wants to email me, emily.peckham@york.ac.uk, or the Closing the Gap email address, then I can act as the conduit to people facilitate making the connection.
Great. Thank you.
Can you hear me all right?
I think Joy is in the queue waiting to talk to us.
Oh, right. Yes, should we have Joe to speak? Yeah.
Oh, hi, can you hear me?
Yes.
Yeah.
You can. Oh,
Yeah, we can hear you, yes.
sorry, you were breaking up there.
Yes. Hello,
yes,
we can hear you.
I'm not sure if I am the same Joe Smith that David knows from years ago, but I'm a dietitian by background, working for TZESC and Weir Valley's NHS Foundation Trust, and currently on a secondment doing a research role to sort of the NIHR and Teesside University and TUV, so a three-way post. And obviously you've got an interest in the altered eating work. Obviously I've met Mia already, and looking at kind of anything to do with weight management and that kind of thing. But I'm also a carer for a young man who has an SMI as well. So I'm very much kind of familiar with the issues around the current sort of situation and the impact that that's having, particularly on caregivers from a personal perspective. So nice to meet you all.
Nice to meet you too.
Nice to meet you too, Jo. So before we finish, me to act as the sort of matchmaker in all this, please just send me an email and I'll match people up and that. Has anybody got any final questions or anything else they want to say before we conclude the webinar? Everybody happy? All questions answered?
Yes.
We'll go on to receive quite a few Collaboration Fund applications. If you need any support, anybody wants anything, please do contact us. Thank you to everyone for joining us today, and hope you all have a nice rest of the day. So Panos has just put my email address up there if you want to contact me. So we'll just wait a few minutes before we close everything down so people have time to note that down if they want it. But thank you, everybody.
Thank you very much.
Thank you.
Thank you.
Thank you.